Hello, and welcome. Today we're diving deep into a complex yet fascinating topic: tetralogy of Fallot, a congenital heart defect affecting newborns. We'll explore what causes it, how it impacts the body, and the journey towards diagnosis and treatment. Join us as we unravel the complexities of this condition and shed light on the lives it affects. Tetralogy of Fallot, or TAR, doesn't have one single cause. It's considered a multifactorial condition, meaning it arises from a combination of genetic and environmental factors during pregnancy. Certain genetic syndromes, such as Down syndrome and Di-George syndrome, are associated with a higher risk of TAF. Maternal factors like poor nutrition, alcohol consumption, certain viral infections like rubella, and some medications during pregnancy may also increase the likelihood of this defect developing in the fetus. However, in many cases, the exact cause remains unknown. To understand tetralogy of Fallot, let's break down the tetra, meaning four. The condition is characterized by four distinct heart defects. First, ventricular septal defect, or VSD, a hole between the two lower chambers of the heart, the ventricles. Second, pulmonary stenosis, a narrowing of the pulmonary valve, or the area just below it, which obstructs blood flow to the lungs. Third, overriding aorta, where the aorta, the main artery carrying blood to the body, is positioned abnormally, sitting over both ventricles instead of just the left. And finally, right ventricular hypertrophy, a thickening of the muscular wall of the right ventricle, caused by the increased workload required to pump blood through the narrowed pulmonary valve. These four defects work together to reduce blood flow to the lungs and allow oxygen, poor blood, to circulate to the body, causing cyanosis, the bluish tint associated with the condition. Tetralogy of Fallot affects approximately 3 to 5 out of every 10,000 live births, making it one of the most common congenital heart defects. It accounts for about 10% of all congenital heart disease cases. While it occurs worldwide, specific demographic variations are not well defined, and studies are ongoing to understand if certain populations are at higher risk. The signs and symptoms of tetralogy of Fallot can vary depending on the severity of the obstruction to pulmonary blood flow. The most prominent sign is cyanosis, a bluish discoloration of the skin, lips, and nails, particularly noticeable during crying or feeding spells. These TET spells are sudden episodes of deep cyanosis, often accompanied by rapid breathing, irritability, and sometimes even fainting. Other symptoms may include a heart murmur, poor weight gain, fatigue, shortness of breath, and clubbing of the fingers and toes, a widening and rounding of the fingertips due to chronic low oxygen levels. Diagnosis of tetralogy of Fallot often begins with a physical examination where a heart murmur is typically detected. An echocardiogram, an ultrasound of the heart, is the primary diagnostic tool. It allows doctors to visualize the heart's structure and function, confirming the presence of the four characteristic defects. Other tests may include an electrocardiogram, or ECG, to assess the heart's electrical activity, a chest X-ray to evaluate the size and shape of the heart and lungs, and pulse oximetry to measure the oxygen saturation in the blood. Cardiac catheterization, an invasive procedure, may be used in some cases to further evaluate the anatomy and pressure within the heart chambers and blood vessels. While tetralogy of Fallot is defined by its four core defects, there aren't specific subtypes or classifications in the traditional sense. However, the severity of each component, particularly the pulmonary stenosis, can vary significantly from patient to patient. This variation influences the timing of surgical intervention and the overall clinical presentation. The primary treatment for tetralogy of Fallot is surgical repair. There are generally two surgical approaches: complete intracardiac repair, and less commonly now, a staged approach. Complete repair involves closing the ventricular septal defect with a patch and relieving the pulmonary stenosis. This may involve widening the pulmonary valve or reconstructing the pulmonary artery. A staged approach, used for very small or premature infants, involves initially creating a shunt, a connection between the aorta and pulmonary artery, to increase blood flow to the lungs. Complete repair is then performed later. After surgery, lifelong follow-up with a cardiologist is crucial to monitor for potential complications such as arrhythmias, pulmonary valve regurgitation, and right ventricular dysfunction. Medications may be prescribed to manage symptoms before surgery and to prevent complications after. Unfortunately, there's no guaranteed way to prevent tetralogy of Fallot, given its complex and often multifactorial etiology. However, women planning to become pregnant can take steps to minimize risks. These include ensuring adequate folic acid intake, avoiding alcohol and smoking during pregnancy, managing pre-existing medical conditions like diabetes, and getting vaccinated against rubella. Genetic counseling may be recommended for families with a history of congenital heart defects. The prognosis for individuals with tetralogy of Fallot has dramatically improved over the past few decades due to advancements in surgical techniques and medical management. With successful surgical repair, most individuals can live active and fulfilling lives. However, lifelong follow-up with a cardiologist is essential to monitor for potential long-term complications. Current research is focused on improving surgical techniques, understanding the genetic basis of TAF, and developing strategies to prevent long-term complications such as arrhythmias and pulmonary valve regurgitation. Studies are also exploring the impact of exercise and lifestyle modifications on long-term heart health in individuals who have undergone TAF repair. Ongoing research offers hope for even better outcomes and improved quality of life for those affected by this complex condition.